This time, I will explain about the pain fellowship training program, coding system, and reimbursement in Korea. So, the competence in the practice of pain medicine require advanced training, intervention technique, experience, and knowledge. And intervention techniques are unique procedures performed by a pain physician. Therefore, a certification program in pain physician is designed to help recognize practitioners' knowledge and skill in this clinical field. So, appropriate examination and certification is designed to accurately reflect the quality of care given to the pain patient. Therefore, the Korean Pain Society developed a certification program which evaluates the currently assessed level of knowledge and this is for the expertise in intervention technique. So this is the website of the Korean Pain Society, and we provide a certification in intervention pain physician through the highest quality education. The purpose of a certification program in intervention pain physician are as follows. First, to establish the knowledge, domain of practice pain medicine for certification, and to evaluate the knowledge and technical practitioners in pain medicine, to encourage professional growth in practice with intervention technique, and to serve the public, improve quality patient care in the practice of pain medicine. So, Korean Pain designate several hospitals as authorized hospital for the certification in intervention pain physician. The applicants have to take training in this hospital. So we perform the research and application facilities, and in Korea, if your pain center has more than 1,500 patients a year, then you can train one fellow. If more than 3,000 patients a year, you can train 2 fellows. So this is the sheet form of the research for education facilities, and we check several kinds of blocks, including epidural, joint block, TPI, peripheral nerve block, static ganglion block, and so on. Examination are considered 3 parts. Part 1 is the document examination. So applicants must fulfill or get as follows: more than 20 points manual training grade in pain medicine, and at least 1 presentation poster in scientific meetings of pain, and at least 1 published paper in the Korean Journal of Pain or the Korean Journal of Anesthesiologist as first or corresponding author. And completion 2 days cadaver workshop, and you have to receive the more than 1 year pain fellowship course in the staff training hospitals. Part 2 is the written examination. So examinee will be asked to answer 100 multiple choice questions in 2 hours. And the question will cover all current medical knowledge and intervention techniques about treatment of pain available to a pain physician. Part 3 is the oral examination. So for practical examination, each candidate will be evaluated by more than 2 examiners, and candidates should not be evaluated by examiners who are known intimately by the candidate. And this examination will consist of identifying anatomical structures and technical instruments that can be used for the intervention procedures. So this is the certificate for the examination, and from 1996 to 2010, a total of 550 physicians received the certification in Korea. So renewal of the certification should be done every 5 years, and more than 1 of the points of the annual training grade in pain medicine for 5 years is required, and there's only from document examination. This is our pain center members. So we have 3 faculties. So me and Professor Kim and also Professor Moon. And there are 2 clinical professors, and we have 7 doctors, 4 fellows and 3 residents, and we have 8 nurses and 2 X-ray technicians and 3 nurses, 1 physician assistant, and 1 medical record officer. So here you can see our operating theaters. We This is a very big room, therefore we divided it into 2 rooms, and each room usually covers around 30 procedures under fluoroscopy every day. So this is outpatient clinic. And our hospital has a short-term business fellowship program. Therefore, if there's anyone from Taiwan who wants to do this fellowship, you can apply for that. This is the number of outpatients in pain center in our pain center, and the number is increasing. And we got excellence in pain practice from WP in 2011. How this coding system? The periodic revision of the International Statistical Classification of Disease and Related Health Problems has, since the 6th revision in 1978, been coordinated by the World Health Organization. As the use of classification has increased, so understandably has the desire among users to contribute to the revision process. The 10th revision is the product of international activity, cooperation, and compromise of numerous international and national specialist group and individuals in many countries. So you can see the report of the International Conference for the 10th revision of the International Classification of Disease, and Korea was one of them. And Statistics Korea. So Statistics Korea also identifies and promotes national health indicators. It matters such as life expectancy. They're used to compare health status and health system performance and characteristics. To make sure that these measurements are comparable and meet the same quality requirements, we have to refer a statistics information standard. So this is the website for Korean standard statistical classification. And Statistics Korea revised the Korean standard classification of disease, KCD, to reflect changes in domestic health and medical care environment and improve international comparison. KCD has been revised 5 times after it was adopted in 1952 for the compilation of healthcare statistics. This 6th revision was notified on July 6, 2010, and came into effect on January 1st, 2011. So major revisions are subdivision of high-frequency disease codes and the application of ICD-10 updates that are recommended by WHO, and Korean disease terms are corrected by referring to the new glossary of Korean medical terms. And this name of Oriental medicine is included as U code in case 6. So here you can see the classification of disease. And this is second page for that. And most familiar classification that are related with pain medicine is the number 13, disease of the musculoskeletal system and connective tissue. And this is the name of the Oriental medicine is included as U code in case 6. So we divided it into 2 parts, and one is this name of the Oriental medicine, and the other one is this pattern and syndrome of Oriental medicine. This is an example of the system of disease classification. So iliotibial band syndrome. So we have some kind of subgroups under it. So with case 6, the Statistics Korea contribute to the development of health and medical care by providing data to be used for health care policy and by exchanging and sharing information with the international community. And Korean Pain Society using the case 6 and trying to amend in our own way to make it more appropriate for the Korean people. Now I want to talk about the reimbursement in Korea. There is a national health insurance service in Korea. This is the website for it, and we have to charge version 2. So if you have an interest, you can look at this website. And we also have healthcare insurance review and assessment service, as we call HIRA service. So this is the National Health Insurance Operating System. So if the patient comes to a healthcare institution, then healthcare services provided by the healthcare institution, and patient has to pay some part of expense, that's co-payment. And after then, healthcare institution asks the corporation to pay for care back expense. That is the corporation's share. And HIRA review and assess it. And after that, HIRA announced review to the operating healthcare institution and also to the NHIS. Then NHIS reimburse money to the healthcare institution. So this is almost the same slide. So each insured person paid a co-payment, and healthcare institution asked the corporation to pay for its share, and HIRA evaluate and decide how much money they will give to the healthcare institution, and announce it to NHIS, and NHIS pay the money to the healthcare institution. So the ratio of co-payment is different from between inpatient and outpatient. So inpatient, in case of inpatient, 20% total treatment cost is paid by the patient. So, but if he or she is a reduced CAS patient, he or she has to pay only 5% of the total expense. And if the patient has a reduced care, incurable disease, then he or she has to pay 10% only. But outpatient is different. So if in the higher level, general hospital, patient has to pay 60% of the total treatment costs and other expenses. In general hospital, it depends upon the administrative district, but anyway, they have to pay 45 to 50%. In pharmacy, 35 to 40%, and hospital and clinic, patient has to pay 30% of the total care plan expenses. When the health insurance review and assessment service HIRA confirms that co-payment in relation to the care institution service is overcharged, the excess amount is paid back to the medical beneficiary, the insured. HIRA determines the patient fee magnitude contrast-based on healthcare reimbursements. So most important thing is to determine the resource-based relevant value score. It is calculated by considering the amount of resources, including time, effort, work amount, manpower, equipment, and facilities used in the medical treatment risk. And they also calculate the patient fee based on the agreement between the head of the NHIC and the representative providers. The final fee schedule may vary for identical services in different institutions. So let's look at the basic structure of the RV score item. And in 1977, the fees scale only had 9 different sections consisting of 763 items of covered medical services. But later, maybe I can see this, 2009, there are 7 sections consisting of 7,300 items. So it is expanded and specified. Here to see the material cost management. So only among, 13,164 items, only 1,056 materials are uncovered by the insurance. So if the healthcare institution has some dissatisfaction with the reimbursement, they can claim. They can send a claim to the HIRA. Then they will evaluate it, and if there is unfair thing, they will return money to the hospital. Okay. So, Korean healthcare system is a non-profit institution. The National Health Insurance Corporation is a single insurer that provides health insurance to all citizens living in the country, and the corporation is responsible for operating a health insurance program, including managing the enrollment of the insured and their dependents, and collecting insurance contribution, and making a med fee contracting discussion with medical suppliers, and providing health insurance benefit. And health insurance review and assessment service, evaluate medical fee, quality care of the institute, and adequacy of the medical service. Thank you.